All right, good afternoon. It is 12
Oh, just
o'clock,
that,
so
like that
we'll
song. That song always annoys me.
go ahead and get started. If you
That song
would
annoys me. Yes, I don't like that
please
song.
mute your microphone so that there's no feedback, that'd be great. Appreciate it. All right. So as I said, welcome. I want to respect time. It's 12 o'clock, so we'll go ahead and get rolling. If you want to put your camera on and wave, that'd be great, or say hello. I would love it. Nancy, you look very comfortable. I would love for everybody to put your name and the organization you're with in the chat. That'd be great. We just kind of like to know who we're talking to. I think we're all among friends here, which is awesome. So this meeting will be recorded and posted later on so that you can view it. So stay tuned for details about that. And with that, I am going to go ahead and share my screen. All right, so let me know if you are able to see my screen.
It's good.
All right, perfect. So we'll start with introductions. I'm Joy Griffin. I'm the Director of Community Health Improvement for Tarrant-Parker counties, and I am recovering from COVID, so forgive me if I cough. I apologize right off the bat. It's going to happen. And I will go ahead and bounce it over to the team to introduce themselves, and we'll start with Beth.
Hi, I'm Beth Harrison. I'm Program Manager for the Tarrant-Parker Community Impact Team as well. I work with Joy and two other program managers who will introduce themselves shortly. And my areas of responsibility include the Arlington and HEB service areas. And Kimberly?
Good afternoon. I'm Kimberlyn Moore, and I'm one of three of the program managers for our Tarrant-Parker group, Community Impact. And my service area is Texas Health Fort Worth and Texas Health Southwest. And welcome, everyone.
Yes, welcome, everyone. I'm Melanie Neswadomi, and I am another program manager with Tarrant-Parker. And my service areas include North Tarrant, so Texas Health Alliance, and then in Parker County, Texas Health Azle and Texas Health Willow Park. Welcome.
All right, thank you. So I think some of you guys on the call today have probably seen this presentation, so it doesn't hurt, I guess, to see it again. But it won't take long. I think what I'd like to do is just go through this presentation. If you have a burning question or you think of something, jot it down or go ahead and put it in the chat. And so we will answer all those questions at the end. And then, of course, if you want to just verbally ask at the end, we'll have plenty of time for that. And I think the plan is to stay on until we answer all of your questions. So even if we go over a little bit, that's okay too. So I like to start with the story of the broken porch because it's a great example of what we do and why we do what we do. It's a true story. It happened at Texas Health Azle, one of our entities. An older gentleman lived in a mobile home, and it had a deck porch, front porch, as most mobile homes do. It was dilapidated and not in good shape. One morning, he walked out and he fell through it and broke his leg so significantly that he had to have surgery and stay in the hospital for 3 nights. Now, in that time, the hospital and the social worker, the community mobilized around him. They repaired the porch, they installed a ramp and got him a wheelchair that he could come home with, scheduled his follow-up appointments, they filled his prescriptions, they worked with a local food pantry to get some easy to prepare food, they set up home health and on so that when he was discharged from the hospital, they didn't send him right back to the very environment that had sent him there in the first place. And that's a wonderful story, but that's not where our story ends. In those same 3 days that he was hospitalized, the hospital, the emergency department, treated and stabilized 18 other patients who came in with diabetes, uncontrolled blood sugar. And so once they got them stable and got the blood sugar level down to an appropriate level, then they did discharge them right back to the area, to the place that sent them there in the first place, right? Sent them right back home. And so what we know is that if we only treat the health concern and not the whole person and the underlying causes and any social determinants of health, then we really aren't making a big impact with sustainable results. So I'm not sure, I'm getting some feedback. So if we can mute microphones. Okay, great. So now I'll give you a quick overview of community health improvement. That's our larger overarching department of which Melanie, Kimberlyn, Beth, and I are a part. And you can see our mission, vision, and purpose there on the screen. And Texas Health Community Impact is really the funding arm of this larger department. And Texas Health Service areas have been divided into five regions, and obviously ours is the Tarrant-Parker region. Each region has a leadership council, and they are the ones who make the funding decisions, and they oversee these grant programs. So when proposals are submitted for consideration for funding, they are the ones who make those decisions. We fund programs at the zip code level. And for this current cycle of grants that we're in right now that ends in December, Texas Health invested $5 million into our communities of greatest need. Now for this next cycle, the one that we're going to talk about today, 2023-2024, thanks to Texas Health, but also matching dollars from Communities Foundation of Texas, we will invest up to $8 million in the community. And we did just recently find out that $2 million of that will be designated for the Tarrant-Parker region. But I want to draw your attention to the bottom of the slide. Anything that we support or fund must align with the 5 guiding principles there at the bottom. So we view our communities through a health equity lens, and the picture at the right is a great, illustration of that, giving people what they need, not necessarily giving everybody the exact same thing. And then, as I said, we do target communities of greatest need, underserved populations, and we use data to do this. We like to say that we're data-driven and outcomes obsessed. We also know that you have to meet people where they live, work, play, and pray, focus on the whole person to have the greatest impact. And then, of course, we select programs that are innovative. And so these are social determinants of health that I know everybody on this call is very familiar with. All of these things affect a person's health outcomes and have to be considered and addressed when developing programs, just like we heard in the broken porch story. All right, on this map, the blue arrows are the zip codes where we currently have grant programs in this cycle now that's going to end in December. So the upper left, 76082, that's Springtown out in Parker County. At the bottom in the middle is 76119, and that is Southeast Fort Worth. And then over at the right, 76011, 76010, those are in Arlington. And the Leadership Council did decide to keep all 4 of those zip codes for this next round. And then in the middle, where the yellow oval is, those 2 zip codes were recently added for this next round, and that's 76104, 76105. So the next couple of slides, I have information about Parker County. And this area is rural, and it has a very limited number of providers. In fact, they have almost double the number of people or residents to primary care providers when compared to the state of Texas, and more than double the number of people or residents to mental health providers compared to the state of Texas. And their food insecurity rate is fairly significant as well. I think it may be for the state, or it might be for DFW area, it's 13%. So it is elevated. So you can see that there's some issues there that we're looking to address. So in Parker, the goals and objectives are really around access. So program goal 1, improve health outcomes by increasing access to services addressing social determinants of health, such as primary care, counseling, dental health, healthy foods, transportation. And that first objective, improve quality of life as evidenced by a standardized tool among low-income adults, 18 and older. And then the second objective, increase access to healthy foods as evidenced by standardized tool among low-income adults 18 and older. The idea being here that because Springtown is rural, we want to improve access to care and access to healthy foods. You'll notice we did not name a specific assessment tool because the applicant will determine that, but we do need outcomes or some way to show success and progress toward goals. So we'll shift gears a little bit and move over into Tarrant County. This is Arlington data. In Arlington target zip codes, high blood pressure and diabetes are some of the biggest issues that community is facing. High blood pressure is higher in the 2 target zip codes than the city, about 20% higher, I think. And diabetes prevalence is about 1.5 times higher than the city at large, city of Arlington, in those 2 target zip codes. A high socio needs index, as you can I'll just tell you right now, 100 is the highest number. So for 76010, they have 98.1 81%, and in 011 it's 88.7%. So that definitely indicates high need. A lot of things are considered in that socio needs index, demographics, income, education, insurance, and so on. So you can see that there is high need, and we're on target here by hitting these 2 zip codes. There is a high need there, and then the uninsured is high as well. It's about double what the city of Arlington has just in these 2 zip codes. So over in Fort Worth, it's even worse. Unfortunately, diabetes prevalence in the 3 target zip codes is double that of the city, and high blood pressure is about 50 to 60% higher in these zip codes than the city. Of course, high socio needs index, you can see 97, 98, and then 97.9%. So all very high need in these zip codes. And uninsured numbers are more than double what they are for the city of Fort Worth. All right, so what are we really saying here? Roughly in Arlington, target zip codes, 1 in 3 has the high blood pressure and 1 in 6 has diabetes. In Fort Worth, target zip codes, 1 in 2 has high blood pressure and 1 in 4 has diabetes. So pretty staggering. So all of that data led the Leadership Council to these goals for Tarrant County for this next grant cycle. Program Goal 1, improve quality of life in adults 18 and older living with chronic disease by increasing services such as dental or eye care, healthy foods, mental health services, job training, transportation in those target zip codes. So you do not have to pick both, you can pick one or the other. The second goal being improve health outcomes of adults 18 and older living with chronic disease, specifically diabetes and/or high blood pressure in targeted zip codes by December 2024. And so, as I mentioned, you can do one or both. The Leadership Council was deliberate in putting the quality of life goal first, because we know that if you don't work with the individual on what they see as a priority or what is most urgent, then we'll never be able to drill down to what we believe the biggest issue is. And that's one thing COVID has taught us is that is really true. So whatever is going on in that person's life, typically it's those basic needs. I just need to pay my electric bill. I need to put food on the table. Those are the things that are always going to take priority. Even if someone has really, 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 high blood sugar, really high, uncontrolled diabetes, it's just not a priority if they're trying to figure out how they're going to put food on the table. And so that really led the Leadership Council to say, hey, we got to give these guys hope. We've got to help improve their quality of life. And then we can get down to addressing the health concern. So as I mentioned earlier, to accomplish these goals in all 6 zip codes, we have been awarded $2 million to spread across all 6 of the zip codes. So we're pretty excited about that. That's the most we've ever gotten. So now let's talk timeline. The request for proposals was just released, as you know, on July 15th, and proposals are due back September 16th. Now, on some of the communications that have gone out, the due date said September 15th, but it is in fact September 16th. So you do have an extra day. And I think it's 4 p.m. Is that right, Beth? I don't know if I would swear to that.
Yes, it is.
Okay, 4 p.m. on September 16th. So you got an extra day. Yay. The Leadership Council, so my team, the team that's on this call today, we will review applications, and then we will work with the Leadership Council and help them to review the applications in September. And then the top contenders, those top proposals, will be invited to present at the October 14th Leadership Council meeting, where a funding decision or funding decisions will be made. And I believe that we will have the presenters present virtually, but that could change, so don't hold me to that. But that was the thinking initially. Rather than having you come to a meeting, it might go a little quicker if we can just have you pop on and pop off. So stay tuned for details about that, but I think that's how it's going to go. And then, of course, we will fund by the end of the year. All right, so let's talk a little bit about funding requirements. All of this is outlined very nicely in the RFP, but there are some big things, so we'll go over those. We do not fund individuals or single organizations. We only fund collaborations of 2 or more organizations. There will need to be one lead organization within that collaboration. And so that lead organization will handle the coordination of the collaboration. We will fund the lead organization, and the lead organization funds its subgrantees or collaborators. programs should be innovative. So not just doing something that you haven't done before, but doing something that no one has done before. And sustainability, Texas Health, it's never been our mission to be your sustainability plan. So from the very beginning, be thinking about how to keep this program going. As you saw in our purpose, we want to be that catalyst. We want to help you get started, but our intention is for you to keep it going. And typically, lead organizations are eligible for 2 cycles of funding. And then beyond that, that's where we would hope that all the kinks would be worked out, and you would be able to keep that program going by your own sustainability plan. So as we mentioned, we are data-driven and outcomes obsessed. We always need outcomes, and we do have an independent evaluation partner who works with all the grantees on data and outcomes. So you do need to have your screening tools and ways to measure success or progress. And then obviously, you know, how a person would enter the program and how they are referred within that program should be clear. And those are things that, you know, that we've just kind of come up with over the years. There's more, I'm sure, and it's in the RFP, and you might be having questions about that today. So this is just a very simple and rough example of how a program might work. A community center or a church, they have a food partner and a counseling partner and maybe, let's say, transportation, and they collaborate with primary care and dental care. And participants could enter the program through any of the partners. Clinics can identify a patient in need and do initial screenings and make referrals, or the community partner could do screenings and make a determination of what the individual needs and refer appropriately. So, for example, the community organization might host an event in the community and do an initial food insecurity screening and a PHQ-2 depression screening, as well as some other questions about health related to chronic disease. Based on answers to these questions, participants would be referred appropriately to services. Each partner would have their own screening tool and would take baseline and follow-up assessments to measure progress and then report that to the lead organization. The lead organization would then report to the evaluation partner and to Texas Health. So I know that was really quick, but it's just kind of an idea of how that might work. So hopefully I did not confuse you. Hopefully that was somewhat helpful. And at this time, I am going to stop sharing, and we can start taking some questions. Okay, did I stop sharing? I can't tell.
Yes.
You did,
Okay.
but are you trying to be on camera? Because it's not showing you, and my camera's not working now either.
I'm not. I took myself off camera. I get distracted because I can see myself down in the corner when I'm presenting, and I don't really want to look at myself.
Cute.
All right. What questions can we answer, or what discussion is there? Oh, it looks like maybe there's some in the chat. Let's see.
Well,
No,
Michelle has her hand up. Joy, Michelle Krim has her hand up.
Michelle.
Literally has my hand up.
Really? Oh, Nancy does too.
Joy, this is very helpful. My question is on the partners, do they all have to be another nonprofit, or could they be a for-profit organization?
That's an excellent question. I think they can be a for-profit. I will get clarification on that. I know that the lead organization cannot be a for-profit or like another healthcare system. Like JPS could not be the lead organization, but JPS could be a collaborator. Does that make sense? So let me make sure on that, but I think they can.
Okay, thank you.
All right, Nancy.
Sorry. So would we start January of 2023? That's my question. So I know you'll decide. So it's a year, basically, January 23 to December of 2023. Is that correct?
It's January of 2023 to December of 2024. And Beth's going to have to help me because I've only looked maybe once at this, but I want to say it's like within 4 or 5 months of that first year, we would expect you to start actually serving individuals. So there is a little built-in time there for to ramp up and build and get things worked out and MOUs signed and the process and planning in place. Is that right, Beth? 4 or 5 months? You're on mute.
You're muted, Beth.
I'm not used to being muted.
We're not used to that either.
Nobody puts baby in the corner.
Wow. Let me scratch her off the list. It's first quarter. I think they want it within the first quarter to be up and running. So by second quarter, you're ready to really roll.
So April. Okay.
I think
Okay.
so.
Okay, thank you.
Chat to see anybody else. These are great questions. I can tell you some of the questions that I've gotten, if that might be helpful, that we've gotten from other organizations that might lead to something else. One of the questions, I've actually gotten this question a few times. So can an organization be the lead organization on one proposal, but a collaborating partner on another proposal? And the answer to that is yes. Yes, you can do that. You can collaborate on more than one of these grant proposals. You can totally do that. Can a collaboration apply to work in only one zip code? So for example, in Fort Worth, there are 3 target zip codes, but let's say, you have an affinity for just 76119. Can you apply just to work there? You can. Now, I will tell you, I said the Leadership Council is the one who makes all of these decisions, and they review and they decide what happens and what doesn't. We don't really have a say in that. But I will tell you, based on experience, they do like it when organizations apply for all in one area. So all of Fort Worth or all of Arlington, that kind of thing. Or what they might do, let's say somebody applied to work in all 3 and somebody else applied to work in only one, but both of the plans are just fantastic. They might ask you to work together. So just keep that in mind as you're doing your proposal, but you can certainly do that. You can certainly apply for one. I think that's good. What other questions? What other discussion? Fran Martin has her hand up.
Joy, I wanted to add on to that as well. So let's say that your specialty is, or you feel most comfortable in, say, 76119, but you know some other organizations who target their work in, say, 76104 and 105. That's where the collaboration comes in. Reach out to them, bring them in, and then together y'all could cover that area within your application. Does that make sense? Okay. And
that's exactly right.
Deborah Cox
had put in. Kimberly, did you have something to add to that?
No, I was just saying Deborah Cox has a question in the chat.
Yeah.
Can we apply to more than one region? Fort Worth, Dallas, Collin? And the answer to that is yes, absolutely. Hey, Fran Martin, do you have a question? Oh, you're on mute.
You're still on mute, Fran.
I was saying that is what I was going to ask. So we can do the Arlington and Tarrant-Fort Worth thing. Okay.
Mm-hmm.
All good.
Yeah, and you can do that, which is within our region, but you can also go outside of the region. So if you're somebody who wants to work in both Dallas and or Dallas Rockwall region and the Tarrant-Parker region, you can apply for that. You sure can.
Okay, thank you.
Great questions.
Joy, I'm trying to keep track of who all is in our meeting, and I just wanted to see if whoever's logged in with the phone number 214-448, can you identify yourself just so I can make sure I've got you listed as having attended?
Who are you?
Who's 214-448?
And maybe they're muted. I don't know.
And it's okay if you don't want to tell me. I was just asking.
Or you can put it in the chat, I guess.
Yeah. Well, if they're on the phone, they might not be able to.
True.
Beth, I have a question. So for example, Open Arms and I are talking. So Fran and I are talking. And then, so I'm also looking at, Arlington Urban Ministries and Arlington Charities. And if they haven't worked with you guys before, is it okay if we go to them and bring them into this particular discussion?
Meaning they haven't worked with Texas Health before?
Correct. Like, I don't know
Oh,
if
of
they've
course.
received funding from you guys in the past. I know Fran and I have, but I don't know if
Mhm.
they have. So, but
No,
that's
that's fine.
part of that collaborative. And I don't know, maybe they have. That's my question, because I don't know if they knew about this call today. So I just wanted to
Okay.
kind of share and make sure that that is okay for us to do. So if we reach
Yeah.
out to them and try to do all those social determinants of health in Arlington, that would be ideal, correct?
Yeah, no stipulation on having previously received funding from us or be a partner. Yep, absolutely. And then, like I said, this is being recorded. We will have the link to that. And we're not sure exactly where it's going to be. I'm assuming it's going to be posted on our website, but we can find
I
out.
think we're going to upload it to YouTube with the link. There's already a spot on our RFP website page where once it's live, you'll be able to link it there.
Okay.
So then we can maybe link it in this chat here, Beth.
I don't know that they will have access to the chat after we are finished.
Okay.
So we
Good
can
point.
certainly try it, but I don't know that they'll have access to it.
Okay.
And just to go back over some of the questions in the chat. So Letitia asked, can we work with others outside of our region? So Letitia, are you saying like, let's say you're focused on Tarrant, you're talking about maybe bringing XYZ organization in to help in Tarrant, or are you talking about you also working in, say, Dallas and Tarrant?
He says
yes. Okay,
yes.
sorry. Yeah, she can't. I guess her mute button's not working.
Okay. So yeah, so it doesn't matter, who your collaborators are. What matters is that the participants in the program have to be from the zip codes that we just showed you, of the 6 zip codes. If you say, hey, I want to create a program, my collaboration is going to address the 3 zip codes in Fort Worth. It doesn't really matter necessarily who you bring in to help do that work. What matters is that those who participate in the program are from those zip codes, those 3 zip codes. Does that make sense? So we couldn't bring people in from Dallas, participants in from Dallas and address them. You can bring nonprofits in from Dallas, like let's say somebody's wanting to kind of move into Fort Worth as well, and this is a great way for them to get their feet wet. Yeah, that's great. But also remembering that bringing the programs to the people is going to be better. So might not be great to ask them to drive to Dallas or wherever outside of the region. So just kind of keeping that in mind. Michelle Krim had put in the chat, I see there are spots for up to 10 letters of support. Do you want that many? I mean, my answer is no. I don't know that we've ever gotten 10 letters of support. I'm going to have to really pull back the cobwebs here because I can't remember. I want to say we get somewhere around 3, 4, maybe 5. Beth, do you remember? You're in Fountain a lot.
I think because, my grant has so many partners, there were a lot, and I think that's probably why we put that. If you have a number of partners, you're going to have letters of support for them, if I'm not mistaken, Joy, right, for each partner. So
I think so. Yeah.
Yeah. So, when we get to that point too, we can always address it, especially if you find that you have 6, 7, 8 partners or more. So, but no, I don't think you actually have to have 10 or more.
Yeah, typically it goes with your partners, how many partners you have. That's right. And then Matt Hart asks, you mentioned Dallas region. Does anybody know if the Grand Prairie zip codes are included in those target areas? I do not believe that the Grand Prairie zip codes are part of the target zip codes for the Dallas Rockwall region. At some point, it would not surprise me if maybe Dallas and Tarrant region work together on that, because while it's Grand Prairie and it's considered Dallas County, of course, a lot of those folks do come to Arlington Memorial and take advantage of Arlington resources. And certainly 75050 and 75051 have a lot of need. And those are the 2 zips in Grand Prairie. So I would stay tuned for that. I really see that possibly happening in the future. So great question. These are great. This is really good. Fran, is your hand up again, or is that still? I want to make sure I don't.
No, it is not.
Overlook
I
somebody.
didn't see how to put it down.
I think you just click the hand again, and I think it goes away. I think.
Dawn.
Okay, there we go.
There we go. I just want to make sure I didn't overlook you.
I wondered the same thing, so.
Elizabeth Williams says, can you please identify the target zip codes in Fort Worth again? Sure can. Southeast Fort Worth, which is 76119, and then the hospital district, which is 76104. And then I guess, is stop 6 76105? There you go. I stuck them in the chat. Those are Fort Worth. And has there been much interest in Parker County? I do believe we have had one organization already apply, or one collaboration rather, already apply for Parker, and we have a current grantee out there, actually 2 current grantees out there who potentially will be applying again. But you know, Parker's smaller, so we don't have nearly the interest in Parker that we do in Fort Worth and Arlington. So if you're thinking of applying in Parker, that'd be great, you know. And is there a place to see the social determinants needed in each area? So that's a really great question too, but that is totally up to you. It's up to what the collaboration feels like they can provide and provide well. In no way are we saying does it has to be transportation. Now, for example, out in Parker County, let me say this. The thing that they did decide to focus on was access to care and access to healthy foods. So you do kind of have the healthy foods thing, like that's been called out, that the Leadership Council definitely said, you know, we want to address that. But in Fort Worth and Arlington, in Tarrant County, we just said, you know, let's improve quality of life. So that collaboration would determine what they can do and what they want to take on. Transportation can be huge and expensive and a challenge. It's a huge need, we know that. But if that's not something you feel like you can take on, don't take it on. You know, maybe do more, you know, access to healthy foods, education about your chronic condition, you know, whatever it is that you decide to take on. So I don't want to say that there's no wrong answer, but we're not going to be heavy-handed on that. It's really kind of what the collaboration feels like they can do.
And Joy, our CHNA is outward facing, right? Isn't it?
It is. Is it outward facing yet, or is it going to be August or September? We're close. We're close, and it has a lot of information in there.
Hey, Joy.
And that'll be on texashealth.org.
It's Kimberlyn. I believe I went back and looked. I believe the CHNA will be published in September.
There you go, September. And it's got a lot of great information.
Thanks, Ellen.
And that community health needs assessment is really kind of what helped us to guide the conversation with the Leadership Council, primarily because the first thing that bubbled to the top as identified as a top need or the top need truly by the key informant interviews that we conducted and the focus groups that we conducted, chronic disease, chronic conditions, specifically diabetes and high blood pressure, that just kept coming up. It was a recurring theme over and over and over. So that kind of led, you know, the conversation with the Leadership Council, but then also all of the social determinants of health, access to healthy foods and transportation and you know, self-efficacy, learning how to navigate through the resources. That's one thing people, I mean, I don't know that I would know how to do all of that. You know, I mean, there's so many things, there are so many resources in Tarrant County, not as many in Parker, which is why they chose access, but do I know what all of them are? Do I know how to get in touch with people? So navigation's huge. So I would just kind of make a plug for navigation as part of your collaboration. That would be well received, I think.
Somebody has their hand up.
Hi, this is Diane Stevenson with the American Red Cross.
Hi, Diane.
Hi. So this is our first time actually going through this RFP with Texas Health Resources. I did the webinar yesterday with Dallas, and so we didn't know what to expect going into this, and nor to the level of detail and innovation and data-driven that you're looking for, which is obviously very admirable. Our program that we had initially reached out to ask for possible assistance with is our sickle cell initiative. It's not, it's a chronic disease that impacts about 100,000 African Americans across the country. We aren't doing a program that is specifically data driven, but rather one that helps everyone, because it's a blood program, and of course being a national blood bank, blood flows through people's veins into other parts of the U.S. So I'm just wondering if we are really, if we have any sort of fit in this interest, because while it's a chronic disease and it impacts lots of people, we aren't doing this in a way that would be as measurable as I think what you're looking for. So I'm just wondering if that really cancels us out for this.
Maybe not necessarily. But sickle cell is a chronic disease, and so I think about in Tarrant County that first program goal really being to improve quality of life. And so it's not so much about, that second goal is really about improving health outcomes for high blood pressure and diabetes, right? But the first one is improving quality of life, and we just said for chronic disease. We didn't necessarily say for high blood pressure and diabetes. We said chronic disease. So I think there is a place for you. I think that your focus might be more on, here's our population, folks who have sickle cell. Now we're going to help them with, we're treating that, but we're going to help them with those wraparound services. So maybe there's some depression, so maybe we can help them with counseling. Maybe they do need transportation to whatever appointments, maybe they need some nutrition education and access to healthy foods, so we can help with those things. And this is our population, and they have chronic condition, but we're going to help with the wraparound services. So really making a case for the fact that sickle cell is a chronic condition, that these folks do have need for wraparound services. Depression probably is huge, I can imagine. That would, anytime you have a chronic condition, meaning it's not going away, and you're going to have exacerbations and remissions, that would be horribly taxing on your mental health. So I would imagine that could be something that you would want to help with, maybe transportation, maybe nutrition, and understanding, the importance of staying hydrated. I don't know, I'm just making that up, but I think that there could be a place for you. But I think the big thing would be making that case for, hey, this is a chronic disease. They do have need for wraparound services to improve quality of life.
And does the wraparound services need to be part of the program that we are asking a grant for? Because our program is, I think, a lot simpler. I think much simpler than what these other organizations might be applying for a grant for, because we're simply just trying to get more African Americans to donate blood to help with the chronic shortage of blood for sickle cell patients. And so the program itself is really more wrapped around reaching out to community partners to have them host blood drives to promote the need for blood. Of course, the costs associated for us are also around the testing and some other areas. So I'm just trying to, I don't want to, maybe this is an off conversation with somebody separately about this, but I just want to make sure that if we're going down this path, that we're not wasting anybody's time.
Right. And I never want to tell somebody or discourage somebody from applying for money, because of course I want you to do that. And again, the Leadership Council is the one who makes the decision. I will say it would be hard to make a case for that aligning with the goals, the program goals. And if you wanted to, we could have an offline conversation and talk a little further. But I would stress that really we're kind of looking at that quality of life and addressing social determinants of health and wraparound services. So if there's a place for that in your program, then I would definitely say that I think you could make a good case for that. But I'm not sure with the other, but I'm happy to have an offline conversation about it if you want to.
That would be great. Thank you.
Sure.
Joy, Nancy has her hand up, and then Hannah.
I'm sorry, Nancy, you've already asked a question, so I'm just kidding.
That's right. X on my list. You can't ask anymore.
Yeah, we already crossed you off the list. What's
That's
up?
right. I forgot. I can leave now. Hey, just a quick question. Do we, under the guidelines, is it possible to have to hire a part-time employee to help kind of coordinate all the wraparound services as we connect those dots, or is it strictly for services only?
Oh, that's an excellent question. I'm glad you brought that up. I highly encourage hiring even a part-time grants manager person to kind of
Okay.
help coordinate things because, and especially depending on how many partners you have, you know, two partners, three partners might not be as much of a challenge. But the thing is, all of you guys are pretty much nonprofits and you already have a job to do, right?
Mhm.
And so to have to manage and coordinate partner meetings every month or every week or however frequently you do it, to manage, you know, how are you, you know, toward your goals? How's your progress? How's your screenings? What's that looking like? You know, are people coming into the program? Are we referring them appropriately? Having meetings with us because the lead grantee will have a meeting with Texas Health, one of the lovely program managers, every month at a minimum, and then meeting with the evaluation partner. It can get to be cumbersome. It can be a lot of work. Right now, once you get 6 months under your belt, you know, things kind of start working and going a little more smoothly and everything. But I think it's an excellent idea to hire somebody to kind of help
Okay.
manage that. So yeah, that is absolutely allowable.
Okay, thank you.
Just know, Nancy, that I will, you know, if you got awarded anything, I'd probably be your program manager. So monthly, you
Just
have to deal
saying.
with me.
Awesome. Okay.
Be ready. Joy, I don't know if you want to expound on this, but Letitia asked, could we partner with other organizations who have already been awarded a THCI grant? I said yes, but I didn't know if you wanted to go any further on that.
Yeah, for sure. So you mean like, say, our current grantees, you happen to know who those folks are and you reach out to them and work with them for this next round? Of course, I think that's wonderful. And helpful, because if you guys do get selected and funded, then, you know, they kind of have experience. So that would be great.
And
This is great.
Hannah asked if she could get a current list of grantees. I don't know how.
I think we can release that. Yeah, because we did a big press release. So I'll tell you what we'll do is I will give you the lead organizations. I'm gonna put it in the chat so everybody can see. Y'all, COVID brain is a real thing. Oh, my fingers are not working as fast as my brain or something. What's the third one? I got it. There we go. There's our 3 current lead organizations.
And each one of those have different partners. United Way, Tarrant County has the most number of partners right now. And nobody's overlapping, right, Joy?
Mm-mm.
Or wait, there is.
Oh yeah, well,
Sort of, kind of.
kind of. So United Way of Tarrant County, their collaboration applied for both Arlington and Parker. So one of their partners is working out in Parker County, but they are also not funded under the same program, but they're working kind of alongside each other with Parker County Center of Hope, the other grantee out there. So that happens as well. And that was a result of the Leadership Council saying, well, we like both of you guys. We like both of your proposals. Work together. So funded separately, but they work together. This is great. Keep the questions coming.
Did everybody see the list of folks that are in attendance today? So, you know, your wheels are spinning and reach out. Collaboration is big.
Mm-hmm. Many hands, what is it, lessen the, lighten the load or something like that? Yeah, I think that's good. Now, not too many hands, right? Then it gets kind of kind
Chaotic.
of hard to track everybody.
I'm not seeing any more questions in the chat. Oh, here. Letitia asked, how can we get their contact information?
So I think probably the best way to do that would be to have you email, I'll put my email address in there, email me and tell me who you're interested in talking to, and then I can reach out to them and see if they would be okay with me making that connection. I think that would be, which usually it's not a big deal, but just want to make sure. Okay, there we go. There's my email address. Sure. If at any time as you're putting your collaborations together and putting your proposals together, if you have questions, absolutely please reach out to any of us, any of the team on this call. We are happy to answer questions and can jump on a call with you if that's needed. Will this be recorded? It is being recorded right now. If you look up in the top left of your screen, there's a little red dot. That means it's being recorded. And I believe Beth said it will be a YouTube video. And so we will definitely make sure that somehow, how are we going to let these folks know? Well, you have the list of who they are. We can send an email of where it is, and
We will.
so that you can do it.
A master email, kind of like we did for
That's
the
right.
the RFP.
Oh, that's right.
All of the links are available. If you or you go to the website where you've been going, if you've gone there, that showed where you went to select the RFP for the Tarrant, you could just look at that whole page and you'll see that section that talks about the Q&A sessions. And so those links will go live as soon as they're available. And
you said all the regions links will be on there, right, Beth? So that if you're toying with another region, you can listen to theirs as well. So that'll be very helpful. Michelle Krim says it's very helpful. Thank you, Michelle. Anyone on here that deals with youth? That's what Letitia has asked. And we already answered that. All right, so that's good. So that's a good point. I'm sure she's asking for her own reasons, Leticia, but for these particular grants, it is, for us, it's adults 18 and older. Other regions do have youth that they address, but for now, we're doing it adults.
And Cheryl, just so you know, the recording, it'll be shared from our website. We won't be sending an email out with it attached. I think that would be, the size of the file would be too large, just kind of covering all bases. You're welcome.
One of the things that I did touch on in the presentation, we talked about sustainability, and so that'll be something that if your collaboration is selected and funded when you work with your program manager, I told you you'll meet with her monthly, and sometimes I pop in on the calls too, but they do a great job. One of the things that we'll talk about from the very beginning is sustainability. What's your sustainability plan? How do you see this fitting into what you currently do in the future? How do you plan to kind of keep this going? Because one thing we don't want to do is start work and then it does great things and it really starts serving people and then it just kind of drops off and goes away. But I alluded to the fact that lead organizations can be funded for 2 cycles. So that would mean, and if each cycle is 2 years, and that's 4 years, that a lead organization could be funded. Now, at that point, doesn't mean that organization can never apply again. They can, latch on to another collaboration. They just can't be that lead organization. But the idea being that, you kind of work out those bugs in the first cycle. Obviously, we do, want to move the needle a little bit, make some progress, and then really kind of that second cycle, let's say you apply again and the leadership council funds you again, because again, it's not a shoe-in, it's not a for sure thing. You have to apply again. But let's say you apply again and the leadership council funds you, then that second year is probably where you could really kind of figure, second cycle would be where you could figure out, hey, this is what worked last time, this is what didn't work last time, and here's how we're going to keep this going. And of course, we're here with you the whole way. working with you. We've learned so much over these last 4 years. It's just unreal.
Michelle Krim has a question. Does it sound like more than one project could be selected?
So let me ask you this, Michelle. Do you mean period? Or do you mean more than one project per area? Because I will tell you, I bet yes, that more than one project will be selected. We had 3 this time, one for Fort Worth, one for Arlington, and then 2 out in Parker. So I can, doesn't happen often, but on occasion, a collaboration will apply to work in all of the zip codes. Our first round, that's what we had. We had one collaboration and they addressed all, I think it was 3 zip codes at the time, all 3 zip codes. And it worked okay. I will say I like it this way. I like having multiple grantees. And so we have, like I said, we have 3 right now and it's working very well. So I would imagine that multiple will be selected. Now, as far as multiple per area. So if your question is, could 2 be selected for Fort Worth? Anything could happen. Leadership Council will make that decision. I will say, remembering though that, the money, we have $2 million to spread out, so Arlington will get so much, Fort Worth will get so much, Parker will get so much. So the more collaborations that we fund in one area, that kind of divides up the money more. So just kind of thinking about it that way. It would not be unusual for the Leadership Council to say, man, we have 2 really great proposals for Fort Worth and we just can't decide. Let's ask them to work together. True story. That has happened.
Right.
That has happened.
I'm trying to figure out how much money to request. I know it's 2 million among the whole areas, but I don't believe in asking for more than what you need, but making sure that it's split in appropriate areas. So thank you.
Yeah, so that's a great question too. I would say go big, think big. If we get requests for 25,000 or 50,000, they're just probably not going to be funded, right? We're looking for big asks. So for this current round, we got $1 million. And so one of the organizations, they're working in 2 different areas. They got over 500,000. One of the organizations got 175 and another one got 215 to round out that million. We have 2 million. We have 6 zip codes. And I've been kind of thinking in terms of dividing it by Fort Worth gets a chunk, Arlington gets a chunk, and Parker gets a chunk. What that looks like, I don't really know. But it would be, a decent amount of money, I would think. Of course, you can always use more and everything. The other thing I will tell you with community impact, we are much more concerned with going deeper than broader. And what I mean by that is we want to make a deeper connection and a bigger impact on the people we serve than saying, look at us. We've served 3,000 people in Springtown, but how deep was that, impact on them, right? I'd rather say, well, hey, we reached 650 people out there, but look at what we've done. Look at the baseline scores. Look at their scores now. Look at what they, this guy had a, whatever issue that he had, let's say his A1C, his hemoglobin A1C for diabetes was, 12. And now after we've helped to get him to his appointments and we've gotten him access to healthy foods and how to eat appropriately, his A1C is 8. That's really what we're looking for. Now, that's not a license to say, well, we're only going to serve 30 people and we need $1 million to do it. No, but it's much more important that we make a deeper connection, relationship, and impact on the people we serve. Nancy.
Do we
Wonderful.
need matching funds, or we don't necessarily have to have any matching funds? Okay.
Not a requirement. I will tell
Okay.
you, we have had lead organizations have come to the table with matching funds. It was very attractive to the Leadership Council. We've had just as many come to the table with nothing, like a teenager, mouth open and hand out, and it was fine, So it's not a requirement.
Okay, thanks.
Also, Michelle, too, I know Joy kind of split that up between Arlington, Fort Worth, and Parker in her discussion. But if you feel that you've got a great proposal for, say, Fort Worth and Arlington, because some of those folks do cross over depending on their location, that certainly is an option as well.
That's true. This has been really good.
Mhm.
Keeps me on my toes.
And of course, if questions come up, during the process, all of us are, here. Nancy, I'm gonna have you just reach out to Joy though.
And I think thanks for that, Beth. I think we scratched her off. No, I think in the RFP there is like a main, THR, community health improvement, like just a generic email, and you can always, shoot an email to that. I think Beth, you said you've been monitoring that. Some others have been monitoring that, but you can always email me directly too. That's also great.
It's THCI-grants at texashealth.org.
Let me put it right here.
Thanks, Diane. We were hoping that it would be very helpful, especially with questions that everybody might have that we hadn't, addressed or that were cropping up as you were going through the proposal.
Beth, did I do that right? Is it THCI-grants?
Yes, ma'am.
Okay. One more question. Am I over limit? Not at all, Michelle. We like you better than Nancy. It's okay.
Oh, thank you. Although I like Nancy too, but as a grant writer, I have to ask questions. So do we need to figure out who's going to be the lead before we start the grant application? Is that helpful?
Great question. Yes, you need to figure that out.
Thank you.
Just so you guys know, we have a long relationship with Nancy Blinn, so we're allowed to pick on her.
Very long.
Exactly. So I don't take any of it personally.
Nor do we. Where's my
Not at
tissue?
all.
Tissue.
In another capacity, not through community impact funding, I should say. In another capacity, we've worked with Nancy.
And we share dog stories, so it's all good.
That's right. Dog people are
Pictures.
good people.
Exactly.
Well, Nancy, you're so involved in everything Arlington, you can't help but escape. Try to escape you. It doesn't happen.
That's right. I'll find you.
That's right, you will.
All right. Looks like we got about 3 minutes left. Obviously, if it goes over, we can stay on a little longer. Looks like it's kind of wrapping up a little bit, but this has been really, really good. I hope it's been helpful. We will do this. We'll likely do something like this every time for our every time the RFP comes out when there's a new grant cycle coming up.
So Joy, I don't know if this will affect Tarrant-Parker specifically, but I heard this morning from Dallas that they're probably going to host a couple more Q&As. That will probably have to get sent out as a mass email just because we don't know from that list who is interested in Dallas. So you may see some other Q&As. Just kind of pay attention to if it's region specific or if there are going to be some additionals for each region. We have great turnout today. I think we've got a lot of great questions, but there could be more. So just if you get more of those emails from us or the generic announcement emails, just kind of watch and see what is exactly for.
The other thing within the body of the RFP that just came out on July 15th, there is a link to FAQs. Now we've been working on that document, updating it, refreshing it because there was some old information on there. So I don't know if it's ready to roll or not, but you will be able to click on that at some point and kind of see questions that other people have asked and great answers there. A lot of what was asked here today. And then I could be making this up, but I feel like there's another place that's going to be updated as questions come in that you can look at. That could be wrong, but there are places to look at things.
It might be to that the
document.
Yes, right now it is out of date. So I've updated it. We're looking at the questions that are coming in from these Q&As, and so if we see a common theme, we'll add to it as well. So I think that's where the update will be.
Sometimes you don't know what you don't know until you go, oh yeah, I guess I should have asked that. So yeah, the FAQ is a great place to look and see what others have asked. Oh, thanks, Michelle. Both Michelles. We got a Morgan and a Krim. All right. Michelle squared. There's only one Nancy, just saying. Well, the conversation is not over. Always, feel free to contact us and email us or ask to jump on a call. We're happy to do that. Sometimes, just a 5-minute phone call can solve everything, right? So happy to help. If you need anything at all, or after, tonight, you're taking your shower and washing your hair, that's when I always think of everything. And it's like, well, I can't write anything down, So yeah, email us. We get emails at 3 a.m. We not going to answer them at 3 a.m, but we'll, whatever, we're used to getting those, and we'll reply and try to come up with something intelligent. I will get the answer to this. Partners can be for profit. I'm 99.44% sure that they can, but I want to make sure, because I don't want to give the wrong information. But I'm almost positive they can. But I will get an answer to that, and we will put that in the FAQ. And Diane, yes, I will reach out to you, and we'll set up a quick call offline. This has been wonderful. And again, contact us if you need us. Have a wonderful rest of the day.
Thank y'all.
Thanks, guys.